Most nurses have no idea Medicare already pays for services like chronic care management, also known as CCM, and nurses are some of the most qualified people to do this work. The problem is, most nurses were never taught how these programs actually work, why primary care practices struggle to implement them, or how care management can become a real business opportunity. So, in this video, I want to break down what chronic care management is, why it matters, why healthcare is moving in this direction, and why nurses are central to all of it. If you're new here, my name is Natasha. I'm a registered nurse and care management consultant. I help nurses and healthcare organizations better understand care management models from CMS. One thing I really need nurses to understand is this: care management is not separate from nursing, it is the nursing process in action. A lot of nurses are already doing pieces of this work every single day without realizing there are actual Medicare supported programs built around it. So let's break it down. Chronic care management, or CCM, is a Medicare service designed to support patients living with two or more chronic conditions expected to last at least 12 months or until the end of life. These are patients living with conditions like diabetes, hypertension, heart failure, COPD, chronic kidney disease, and many of these patients are seeing multiple providers, taking multiple medications, and trying to manage very complex health needs. CCM was created because healthcare realized something important. Patients with chronic conditions need support between office visits. A 15-minute office visit every few months is often not enough to help patients truly manage chronic disease. Patients go home overwhelmed, they forget instructions, they don't always understand their medications. Some struggle with transportation, some cannot afford medications. Some are caring for spouses while managing their own illnesses, and many patients are trying to navigate all of this alone. That's where care management comes in. CCM may include medication reconciliation, patient education, care coordination, follow up calls, reviewing care plans, helping patients navigate appointments and referrals, identifying to care, ongoing communication and support. In other words, a lot of the things nurses already do every single day. Now, to really understand CCM, you have to understand the bigger healthcare problem. We are dealing with an aging population and rising chronic disease across the country. Primary care practices are overwhelmed, providers are overloaded, patients are falling through the cracks. Many patients leave appointments confused about medications, diet, follow up instructions, specialist appointments, self management, and then what happens? Patients end up in the emergency room, chronic conditions worsen, blood pressures stay uncontrolled, diabetes remains unmanaged, hospital readmission increases, and healthcare costs continue to rise. The Centers for Medicare and Medicaid realized that outcomes improve when patients receive ongoing support, education, and follow up between visits. That is part of what pushed healthcare towards value based care models and programs like chronic care management. And nurses have always been involved with this work, even before these programs became formalized. Because nursing is about coordination, education, advocacy, prevention, and helping patients navigate complex healthcare systems. The issue usually is not whether CCM is valuable. The issue is implementation. Primary care practices are busy. Providers are dealing with high patient volumes, documentation requirements, prior authorization, staffing shortages, administrative burdens, quality metrics, and burnout. So, even when providers understand the importance of care management, many practices struggle to consistently implement these services. Patients need ongoing outreach. Care plans need updating. Documentation has to be completed. Medications need reviewing. Patients need education and encouragement. And all of this takes time, systems, workflow, and consistent patient engagement. That is exactly why nurses are so valuable in this space. Nurses are already trained to think holistically. We assess, we educate, we coordinate care, We advocate for our patients, communicate effectively, and identify problems early. We also help patients understand their conditions and navigate the healthcare system. That is why care management aligns so naturally with nursing. The difference is that many nurses were never taught how these services are structured operationally or financially inside primary care, and this creates opportunity. Nurses can work directly inside primary care practices, doing care management, partner with providers independently, build consulting businesses around care management implementation and workflow support, create concierge style care management models of focus on patient education and chronic disease support. What I really want nurses to understand is your nursing knowledge has value beyond the bedside. Healthcare needs nurses who understand patient care and understand systems because technology alone does not improve outcomes. Patients still need human connection. They still need guidance. They still need someone helping them navigate the healthcare system. And nurses are positioned to do that work. CCM is part of a much bigger shift happening in healthcare right now. Healthcare is moving toward outcome based models focused on prevention, population health, improving patient outcomes, reducing avoidable hospitalizations, improving quality metrics, and nurses are essential to that transformation. I believe nurses are one of the biggest untapped solutions in healthcare right now, especially in primary care and chronic disease management. Because when patients feel supported, educated, and connected, outcomes improve. That human element still matters. If you're a nurse and you're ready to take this further, whether that's partnering with providers or building your own care management business, I go deeper into this inside my mentorship. I'll show you how to actually implement these services, structure them, and get paid for the work you're already trained to do. You can check that out in the description below. And if this video was helpful, make sure you subscribe because I'll be breaking down more care management and value based care topics for nurses.